Hi, I'm Darcy Lafleur. I'm doing my doc physical assessment and case study for Module 3. This is Julie. She is a 68-year-old female. She arrived today in our emergency department by private vehicle with her husband. She complains of having 3 to 4 days of left eye blurred vision, some right-sided numbness, and her right side not working, as well as some difficulty speaking according to her husband, who says she's been talking out of her head. I'm going to complete a full physical assessment on Julie as well as the NIH stroke scale. Here we go. So walking into the room, I see that Julie is a very well-appearing, well-groomed 68-year-old female. Her affect seems appropriate and she's smiling. She has no signs of apparent distress. Her nutrition status appears normal for her height and weight, and she is making eye contact with me. I'm going to go ahead and start with a regular set of vital signs. And we're on the TUSAT. So it appears that Julie, we're going to say, has a blood pressure of 190/110, a heart rate of 98, a respiratory rate, after counting it, and I'll do it in my assessment as well, of 16, a temperature of 98.9, and an O2 sat of 98%. So, Julie, I'm just going to start out with a normal assessment, so just answer my questions. How old are you?
I'm 68 years old.
Okay. And can you tell me what day it is?
I don't know what day it is anymore.
Okay. So Julie can talk to me, so I can make a good assumption that her airway is clear. I can see equal rise and fall of her chest, and I can see that she's having normal breathing, so I can assume as well that for right now her airway and her breathing are normal. She is pink, warm, and dry, and she does have peripheral pulses in her wrist and a good central pulse. So I'm going to go with her circulation for right now as appropriate. Neurologically, I'm going to check her pupils. And they're equal, round, and reactive. On the ALPU scale, she is A for alert. Julie, do you have any numbness or tingling?
I have a little in this arm.
Okay, right-sided numbness. She is able to communicate with me, albeit a little bit slowly. She seems awake and oriented. Do you know where you are?
The hospital.
Okay. But she is a little confused on time, so we're going to say she's awake and oriented ×2. And I'll do a full neuro exam here in a minute, but I would give Julie at this point a Glasgow coma of 13. All right, so I'm just going to start with touching you. I'm going to touch your head and all of your body parts, and we're going to talk about it a little as we go through. Okay? All right. Julie, have you had a fall or anything today?
A few days ago.
Okay. Do you have any pain in your head?
I don't have any pain.
Okay. How about anything going on here?
No.
Okay. Can you open your mouth and stick your tongue out that hole? Good. So nothing going on with your head. I am inspecting and palpating Julie's head, and I don't see anything, and I don't feel anything. I'm going to feel her neck. Do you have any? No, you say you don't have any pain, so nothing when I push?
No.
Okay, and I don't feel any step-offs in Julie's neck. Okay, going down. I'm going to go ahead and listen to Julie's heart. And get an apical heart rate. After listening for 15 seconds, I'd get a heart rate of about, or 30 seconds, get a heart rate of about 98 on Julie. I'm going to go ahead and palpate Julie's chest and feel and make sure that she doesn't have any pain and I don't see any kind of injuries on Julie's chest. Also, what I'd want to do is have Julie completely disrobe and we put her in a gown in a normal situation, but I'm not going to do that for this demonstration. So her chest seems clear. I can hear heart tones, S1, S2. I don't hear any abnormal heart tones. She does seem to be in an irregular rhythm at this point, and she does have a history of atrial fibrillation, as well as the fact that I don't hear any murmurs or anything. I don't know if I said that. Can you sit forward for me? I'm going to listen to your lungs. Nice deep breath in and out. Again, inspecting, I would look at Julie's back and make sure that she doesn't have anything going on here. I want to look at her rate and her rhythm on her respiratory sounds, and then I want to make sure that there isn't any weird sounds going on. On listening to Julie's lungs, they're clear to auscultation and no abnormal lung sounds. She does have equal rise and fall of her chest, and I don't see any retractions while Julie's breathing. So moving on to Julie's abdomen, I'm going to go ahead and inspect her abdomen, and then I'm going to auscultate and palpate because we don't want to get her bowel sounds going. So on inspection, I would look at Julie's abdomen, make sure I don't see any injuries, see anything abnormal on her abdomen. And then I would go ahead and listen in all 4 quadrants for her bowel sounds. And as soon as I hear bowel sounds in one quadrant, I can move on to the next. Okay, and then I'm going to palpate her abdomen. Do you feel any pain in your abdomen while I'm pushing on it?
No pain.
No pain. Okay. All right. And then, Julie, do you have normal bowel movements that you know of?
Yes, I do.
Okay. And anything affect your bowel patterns? Any medications, anything like that that you're concerned about?
No.
Okay. All right. And then I'm going to move on down. I'm going to actually push on Julie's hips and make sure she doesn't have anything when I push on her hips.
No.
Nothing going on there. Okay. And then I'm going to defer doing a visual exam of her perineum, but I am going to ask Julie some questions. Julie, do you have any problems with urination? Any pain, burning? Do you urinate normally? At 68 years old, do you get up a little more often to go to the bathroom?
Sometimes.
Okay. Do you get up at nighttime to go to the bathroom?
Maybe one time.
Okay. Okay. But no other problems with your urination?
No.
Okay. In a normal exam, if Julie needed a catheter, then I would examine her perineum at that time. Okay. Now looking at Julie's skin, like I said, it is pink, it's warm, it's dry. She's got good capillary refill, and it appears that she has good turgor. I would look at Julie's skin from head to toe, and what I want to look for is any abnormalities or to see if Julie has any breakdown of her skin, making sure that it is intact in all places. And if there is any breakdowns, I'd want to document that. So moving on to her legs and her extremities, I'm going to feel your legs. Do you have any pain?
No.
Okay. And I would want to feel her pulses. And feel her pulses on this side. Okay. And then how about this leg? Anything here?
No.
Okay. Julie, I'm going to push up on your foot. I want you to tell me if you feel any pain in the back of your calf.
No.
Okay. Here? Okay. Looking for Homan sign, a positive Homan sign with pain in the calf could be an indication of a blood clot in the legs. And then I'm going to do the same with her arms. I want to feel for bilateral pulses. And I'm going to inspect her arms and feel up her arms and make sure she doesn't have any pain there. Nothing?
No.
Okay.
No pain.
Nope. Good. And everything looks good here. So musculoskeletal wise, Julie, have you ever had any fractured bones that you know of?
No, I haven't.
And have you ever been diagnosed with osteoporosis?
I have been diagnosed with osteoporosis.
Okay. Okay. So good to know in the musculoskeletal evaluation. Um, and then, Julie, you're telling me you don't have any pain. If Julie had pain, I would be asking her for the location of her pain, the quality, the severity, any alleviating or aggravating factors that would cause her pain, and then we would use a universal scale of 1 to 10 for Julie, as long as she can speak. Otherwise, we may use a long faces scale. Julie, when was the last time you felt normal?
A few days ago.
Okay. And what do you think brought you to the hospital today?
Oh, my husband told me I needed to come in.
Okay. Do you know any symptoms that you might have had that brought you in?
My arm feels a little weak.
Okay. Okay. Any other symptoms? How about your vision or
My left eye doesn't see like it usually does.
Okay. Are you blind in it or is it just a little
No,
blurred?
it's just blurry.
Okay, good to know. Thank you, Julie. And then cognitively, do you seem to do well at home? Do you have any hallucinations, delusions, any problems with concentration?
No, I feel a little slow.
Okay, so Julie's affect may be a little bit altered today with what's going on with her. And then you told me that you have a husband, so he lives at home with you?
Yes.
And then do you have any concerns socially, like for finances, any abuse? Are you abused at all? Okay.
No.
How about employment? Are you retired?
I'm retired.
Okay. And then your husband, is he your primary support system or do you have more family?
I have more family.
Okay. And then are you religious at all, Julie?
Yes, I go to church.
Okay. And do you have any particular cultural practices that I need to be aware of?
No.
Okay. Good to know. Thank you. And then generally, how do you feel like your general health is?
It's very good.
Very good. Okay. Do you have any illnesses that you'd like to share with me?
I have a little high blood pressure.
Okay.
The doctor told me, but as long as I take my medicine, I'm usually okay.
Okay.
And I have a funny heartbeat. My heart beats. It doesn't beat in a normal way.
Okay. We'll do an EKG for that.
And my cholesterol is up just a little bit.
Okay. Do you remember what your last cholesterol check is?
It was 240.
Okay. All right. Any problems with your appetite or sleep patterns?
No.
Okay, those are all good. How about any major gains or losses in weight?
No.
Okay. And do you drink or use alcohol or smoke tobacco?
I used to smoke, but I don't smoke anymore.
Okay. And then Julie, do you have any family history of stroke?
My father died of a stroke.
Okay. And then did he have any other history?
He had high blood pressure, and I think he had a heart attack.
Okay. And your mom as well?
My mom is doing well.
Okay, sounds good. All right, well, do you see any of those as risk factors for having a stroke?
I think the high blood pressure can cause a stroke.
That's right. High blood pressure can cause a stroke. And then also the history of smoking is a risk factor, as well as the atrial fibrillation. Sometimes the blood clots in your heart, and you can send it off and send a clot off to your brain. And then the cholesterol is a problem because it can cause some narrowing of the arteries in your carotids where the blood flows to your brain. Okay?
Oh.
So we're going to check all of those things out for you. Okay, Julie? I'm going to move on into a National Institute of Health stroke scale. This is the standard in the facility where I work. We highly recommend that the nurses bring these papers with them when they do their stroke scale and follow the instructions verbatim so they don't miss anything. Okay? So as far as level of consciousness goes, I've already assessed that and have deemed that Julie is alert, and so she would score a 0 on the level of consciousness. Julie, can you tell me what month it is?
I think it's almost summertime, maybe June.
Okay. And then do you know your age?
68.
Good job. Okay. So she answered both questions correctly, albeit a little slowly, but correctly, so she gets a 0 for a score of that. Julie, can you take your fist or your hand and make a fist with your left hand and then open it back up? Good. All right. And then can you close your eyes and then open them? Good. So Julie can follow commands, so she performs both those tasks correctly. She also gets a 0. Julie, I want you to look at my finger and just follow my finger. Good job. So Julie can follow my finger horizontally with eye movement, and so that is also normal, and she gets a 0 on that. All right, Julie. I'm going to grab a towel here. Sorry. Okay. And I'm going to cover one of your eyes with this towel. Okay? And what I'm going to do, go ahead and move your head back a little. Keep your eye open. Okay. And what I'm going to do is I'm going to hold my hand out to the side. And what I want you to do is tell me if you can see me moving my fingers or if they're still, okay? Okay. Moving. Good. Still. Okay. I'm going to cover this eye. Moving. Good. Moving. Good. So Julie, with her blurred vision in the lower left quadrant, was a little confused on whether it was moving or still. So we'll call that a partial, so she gets a 1. Can you show me your teeth? Good. And can you raise your eyebrows? Good job. She's got normal symmetrical movements, and that is a 0. Okay, Julie, I'm going to have you hold, let's do this arm first. I'm going to have you hold your arm out, and I want you to hold it here for the count of 10. Are you ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Now let's do it with this one, okay? Ready? 1, 2, 3, 4. Good job. All right, and now we're going to do this with your legs as well, okay? So I'm going to take this leg and I'm going to hold it up. Not quite as high. You there? Is that comfortable?
Yes.
And we're going to count to 5. I want you to hold your leg off the bed for the count of 5. Ready? 1, 2, 3, 4, 5. Okay? And then let's do this one. You ready?
Yes.
Okay. Try one more time with the count of 5. Good job. 1, 2, 3, 4. Okay. So Julie does have some drift with her her right side, and so we're going to say that she has also another number 1. Okay. Now, Julie, I'm going to show you how to do this leg exercise. Okay. All right. So I'm going to take your shoe off. Take both your shoes off because you wouldn't normally be in bed with shoes on. And I want you to take your heel of this foot, can you bend your knee, and put it against your shin, and then run your foot down your shin like this, okay? Okay. Now, can you do it yourself? Can you try? Okay. Good job. Now, can you do the same thing with this leg?
That leg is okay.
Okay, let's give it a shot. Great job. All right. So she had a little drift on that one as well. And so we are going to give her a 1 for that. Okay. Now, Julie, I'm going to have you touch your nose with your finger. You can do either hand to start out with, and I'm going to show you first. So touch your nose And then reach all the way out and touch my finger. Okay, now do it yourself. One more time. Okay, I'm going to walk over to the other side of the bed and we'll do this side. Right, same thing. I'm going to help you the first time. Touch your nose and then touch my finger. Good. Try again. And all the way out to touch my finger. Good. Can you do it yourself? You get it? Nope. Okay. So, Julie also is having some problems with with touching the nose to the finger, and then with the heel down her shin. So that is all one test, and so she has a present and one win, so she gets a 1. Okay. And then we're going to do a sensory exam on you, Julie. So I'm going to use something that is sharp. And then what I want you to do is tell me if you feel sharp or dull. Okay? Can you close your eyes? Okay. Sure. Good. Sure. Okay, good. Okay. Good. Okay. Okay. Right. So we also had some sensory issues with sharp and dull. So mild to moderate sensory loss, and so we'll give Julie a 1 for that as well. Julie, you can open your eyes now. Can you take a look at this picture and tell me what you see in the picture?
I see a boy in the cookie jar and a little girl laughing and asking for a cookie. And the mom is doing dishes and the water is falling out of the sink.
Good job. Okay. And then can you read this?
You know how down to earth. I got home from work near the table in the dining room. They heard him speak on the radio last night.
Very good. And then can you identify these things in the picture?
The glove, a key, cactus, chair, hammock, feather.
Good. Can you read these?
Mama, tip top, 50, 50, thanks. Huckleberry, baseball player.
Good job. Okay. So she doesn't appear to have any aphasia, so I'm going to give her a 0 on that. And then additionally, she took the last set of work that she did is the test for dysarthria, and she was able to clearly articulate those words. So that also is normal. And finally, I'll test extinction. I'm going to touch both sides of you. Tell me if you can feel my touch on both sides.
Yes. Yes, but this side is not as
Strong.
Mm-hmm.
Okay.
The same.
Okay.
Same.
For both?
I can this side just a little less.
Okay.
I can feel that.
Okay.
Same, just a little less on the right side.
Okay. So she does have some extinction, so we'll give Julia 1 for that. So overall, Julie got a 5 on her NIH stroke scale. I will be following up with the emergency room physician and the neurologist on her results. We will be reassessing Julie's NIH stroke scale every hour for the next few hours, and then we'll continue that as we move her to the ICU. This concludes my assessment for my doc. Thank you for watching.
Did I do okay?